Continuing to listen to American Medicine Today, presented by the Bonati Spine Institute. I'm Kimberly Brummel, joined by world-renowned orthopedic surgeon Dr. Alfred Bonati, Ethan Euchre, and as well Jeff Wagstaff of News Radio 970 WFLA. Before the break, we were talking with oncologist Dr. Kenneth Shane from the Moffitt Cancer Center in North Tampa. He was speaking to us a little bit about myeloma, and that's the bone marrow disease that Tom Brokaw, 74, was just diagnosed with, and he came out with a statement earlier this week. Dr. Shane, do you want to continue telling us about some of those risk factors?
Sure. I mean, I'll tell you, I think one of the things you might want to know a little bit about also is the fact that there's a really nice outcome these days in terms of patients with multiple myeloma, which I think will be really important to listeners, and especially in the setting of Mr. Brokaw's diagnosis and therapy. And I think it's kind of put it in perspective, if you don't mind, is about 10 to 15 years ago, if someone came into my office and I would have said that the median overall survival for myeloma is really 2 to 3 years, which is not a real long period of time. But because of a lot of the research that's been done in places like Moffitt and Mayo Clinic and other places across the country and the world, we made huge strides in that, where we can push that median overall survival, meaning people who live at least that long and sometimes less, to about 7 to 8 years. And in fact, based on certain risk stratifications, risk criteria, we can really divide people into patients who can live greater than 10 years, those around 7 years, and those in less than 2 years, unfortunately. There's still a large group of people we don't do a great job with, but we're trying to continue to work on that. So just to kind of give you a flavor of what we think Mr. Brokaw can expect is hopefully a good quality of life and a good lifespan, even with this mortal disease. I think it's just critical to kind of understand in the setting, and the therapies we use today are generally very well tolerated.
Yeah, that's what I was going to ask, Dr. Shane. What are the treatment options for Mr. Brokaw? And I understand a lot of, especially when it comes with bone marrow, unless I'm mistaken, I've heard that it can be very painful, some of the treatment for this.
Yeah, for him, so right now he's probably in the middle of what we call primary therapy or induction therapy, which is, again, getting his disease under control, hopefully having the best response we can, taking it to almost where we can't measure the disease. Then typically there's a second line of therapy called consolidation, which involves a bone marrow transplant, which is essentially for myeloma or multiple myeloma, a way in which we can give patients high doses of a single chemotherapy called melphalan. And the transplant actually just is a way for us to protect him from the doses of drugs. So we take his cells out, his stem cells, give him the drug, and then give his stem cells back. And the cells go back in and repopulate, and his white cells, red cells, and platelets come back to normal levels, while at the same time we've destroyed, hopefully, as much of the disease as we can. Again, we can't destroy it all, but as much as we can. And this technique allows us to get improved overall survival and control of disease for longer periods of time. And then after that, even, there's another kind of maintenance therapy, which is a low-dose but continued therapy. And this, again, is speculation. I can't tell you what his physicians are planning, but it's generally how we would approach someone who is transplant eligible, someone who's able to handle these kind of things. At 74, Mr. Brokaw is kind of on that fence where it may just be therapy without the transplant, just because of the nature of transplant. But my anticipation is his announcement came right about the same time he would be going under transplant, so that's kind of what I think might be the next step in his disease care.
Dr. Shane, I just wanted to jump in. Earlier in the previous segment, you had mentioned there's different detergents. Are you talking about everyday detergents that all of us use?
No, these are things like, things you'd use for out on oil rigs or, heavy detergents. And even then, these are not things like soap or hand sanitizers, things like that. No, nothing like that. These are benzene detergents, kind of nasty things that you wouldn't want to be on your skin at all.
Interesting.
You wouldn't think Mr. Brokaw would be working with those in the newsroom.
Yeah,
no, definitely not. And again, there are links to it. They're not direct causes, and that's why I kind of caution all my patients is that I really can't tell you what caused this disease, and even if you were associated with this or that, I really be able to say for sure that's what caused it. It's generally a spontaneous issue where, for reason X, Y, or Z, a mutation happened or a genetic change happened in some of these plasma cells and cause it to grow uncontrollably in your bone marrow and start wreaking all this destruction in there.
Well, very interesting. I'm glad you were able to share some enlightenment on the whole issue here. Dr. Kenneth Shane, oncologist at the Moffitt Cancer Center. More information on Moffitt at moffitt.org, one of the nation's preeminent places as far as oncology goes. So definitely want to check them out, and appreciate you joining us on American Medicine Today, Dr. Shane.
Oh, absolutely. My pleasure. Thanks so much for inviting me and having me. Let me discuss an icon like Tom Brokaw. Thanks so much.
You got to have a great day. And speaking of Brokaw, we got this clip here, which he actually has a segment called American Stories that he airs on the flagship here in Tampa, 970 WFLA, and he addressed it on Friday. Here's the clip.
You may have heard this week that I've been diagnosed with cancer, multiple myeloma. That's a cancer of the blood cells in the bone marrow. I've kept the news private for 6 months and hope to continue my encouraging treatment away from the spotlight. But I do have a few thoughts to share on how to deal with friends who have cancer. And we all have those friends, don't we? Don't call repeatedly to ask, how are you? Instead, call with a joke or some gossip. Send a funny YouTube. Send over 4 quarts of ice cream or a large container of chili, music, or a book on tape. If your sick friend has kids, take the kids on an outing. Cancer is a full-time occupation for those affected. They don't need to be reminded that they're sick. They do need to be reminded they're not in this alone.
Absolutely, and that's I think that's great advice for anybody who has friends or relatives fighting cancer. Just because it's they know they're sick, they don't have to keep being reminded that they're sick. So just be there for support.
Absolutely.
And don't shy away from them. That's the time when everyone needs to pull together.
Absolutely. Well, I guess it's time for our favorite segment of the day, Dr. Alfred Bonati and What's New in Medicine Today.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
Well, I was thinking very seriously on some of the different types of problems that happen in the country. And one of the things that is happening very, very frequent now is we listen to people that they are in a depressed mood. It's an enormous amount of increase of people that they are suffering of depression. The depression levels in the antidepressant medication, they jump around 400% increase in young people between 18 and 44 years old. What is that? Why that happens? Well, let me go back a little bit of some history of my own life. When I travel around the world, and I went to countries that they are managed by political situations like a socialistic or communistic countries. Did you ever see in television the faces of the masses of these people? Did you ever look at these people? They look sad. Mm-hmm. They look aged for their own years of existence.
Absolutely.
They also look scared. They look all the time over their shoulders. They cannot talk too much because they're scared to talk. Now, all the abilities of these people are being destroyed. Why do you think that happened? Well, that happened because the people lost their all self-respect. The people lost their jobs. When you lose your job, you lose self-respect. And when you lose self-respect, you become depressed. The number of depression in this country is being unsurmountable this time. And it's because the Democrats are creating slavery. And that slavery is what is creating people who cannot survive by themselves. So they're dissatisfied, they're angry, they're upset, they cannot produce. Their possibilities of increase their abilities are being cut off from the root. So these people live by help of the government. What a sad thing. Come to United States, the best country in the world, or born in United States, the best nation in the world, and start to be an individual who accept the government to support you. What disaster.
And that's a look at what's new in medicine today with Alfred Bonatti, MD.
Well, thank you, Dr. Bonatti.
There's a lot of, he touched on a lot of things there that set off some things in me, actually, as far as just the levels of depression now and things like ADHD and how much of that do you think, Dr. Bonatti, is made up in pseudoscience and things like that? And how much of it is actually real? I mean, I know people, depression runs in my family, which is why it sort of hit home to me. So it's real, but I think some people, they have a bad day and they think, oh, I'm depressed. No, depression goes much, much deeper than that. So there's real depression. And then I think that there's people who just have a bad day and want to get some medicine for it.
Well, if you are being cut off in your possibility to perform in this life, you are 30, 40 years old with all this enormous energy, all these hormones telling you you can conquer the world, and somebody comes to you and say, you need to be in line to get your next payment, I will be depressed.
Yeah. So a political system can certainly to lead to that, and especially slavery, as you call it, which you tend to think we're headed for. We can probably get into more of that in the next segment. I know Jeff actually had a story that he wanted to relate along the lines of what we were speaking about with the oncologist. It's kind of a cancer scare. Luckily, it turned out well. But Kimberly, as we come up against our break, how can people get in touch with the Bonatti Spine Institute?
Well, they can reach out to US 19 and Hudson Avenue. Come visit us. They can call 855-267-0482 or visit us on the website.com. After the break, we'll have more with Dr. Bonatti and Jeff on 970 WFLA. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail. The Bonatti Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at bonatti.com.
All my pain is gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.